Dissection prevention always revolves around catheter placement. Catheters that are abutted up next to the wall of the artery are always going to be prone to dissect. So catheter position and looking at the waveform of the pressure signal from the tip of the catheter, that's the most important things to prevent dissection. Now, sometimes you're injecting into a very small artery. Let's say it's a very non-dominant right coronary, and so the catheter is almost the size of the artery. Well, in that case, you're obviously going to want to inject very slowly. It's not the pressure that does the dissection, it's the flow rate that does the dissection. So you've got to remember, the great thing about ACIST is it's really like, just another pair of hands. So as you squeeze on that ball, the more you squeeze, the faster it comes out. It's not an on-off machine, and it was really meant to simulate a syringe in terms of your ability to control that kind of flow. So if you're in a very small artery with a catheter, you probably should reduce the flow rate, the maximal flow rate, and also keep a light touch with the thumb. So you're just giving a very small injection.